Okay, you guys, so I wanted to show you what is in an epidural kit. And I came up with the idea to just show kind of what is inside the epidural kit because my boyfriend asked me one day, he was like, oh, what's in the kit? And I was like, I had no idea that just lay people wanted to know. And so I'm pretty sure if people are nurses or thinking of going to CRNA school, it'd be kind of interesting to see what is actually like in an epidural kit. And I have this because when I was in grad school, when I was in CRNA school, they gave us these kits so we could like practice when we get home on like the pillow, just so we can kind of get the feel of like the steps and be able to practice the steps of putting an epidural. So in no way is this comprehensive, and it's just kind of like a brief overview of the epidural kit. So yeah, let's get into it. So this is an epidural kit. It has the date of expiration, and then also in the front, which is really nice, it has everything that is in the kit on this side, just like listing everything you can find inside. And then it just also has like instructions for use and other things like that. So yeah, it's nice to actually like read this over in your free time so you can kind of have an idea of what's in here and all that kind of stuff. So if I was in the hospital, I'd definitely have sterile gloves on, a mask, my scrub hat, because it's a sterile procedure. But I'm in my apartment, so I'm just gonna open it up just so you guys can see what's inside. So this would be nicely folded, and you would open it up. Okay, so inside the kit, first we have these like sponges, and then also some iodine. And we use this just to clean off the patient's back really well. So we just like dump this in here and really just scrub the patient's back, try to decrease the risk of infection really well. Okay, so that's that. What else do we have in here? We have some like little papers and things that we can use just to put up under the patient, just to kind of create more space for us to do the epidural. And then this is a little plastic sterile drape that we put onto the patient's back, and it actually has like a little circle that's open, and that's kind of where we put the circle where we would be inserting the epidural. So that's the little sterile drape. And then we also have labels, so we can label our medications that are inside the epidural kit. And then just some of the medications that we have in the kit. This is some Lidocaine with Epi, and this is what we use to do the test dose. After we believe that we got into the epidural space, we use this to make sure that we're not in a artery or vein, and this just helps us figure out if we're in the right spot before starting a drip or giving a bigger bolus, because that could be dangerous. So that's a nice safety measure. And then I just have also just plain Lidocaine, and this is to numb up the patient's back some before we put the bigger epidural catheter in. This just kind of numbs it up so it's not as painful. And I try to use a good amount of this because this really can help so the patient isn't feeling a lot of pain when you're putting in the epidural. And then also just saline, and this is just something we can use to test loss of resistance, and I'll kind of talk about that in a second. Okay, and then what else do we have in here? We have the epidural catheter. So this is actually the catheter that is threaded into the epidural space of the patient, and it has different markings just so we can kind of keep track of how far in the patient's epidural space the catheter goes. But yeah. And then what else do we have? We have, this is the loss of resistance syringe. So this helps us find where we are at when we are going through the different ligaments. And I'll explain that a little better. And then this is the epidural needle, and it has different markings so we can know how far through each of the ligaments we've gotten. And it kind of just gives us an idea of how close we are to the epidural space in a way. So basically, the loss of resistance syringe, and this is just like a stylet inside the epidural needle. But the loss of resistant syringe, we can either put air in here or we can use saline. When we're attempting to put in the epidural, we'll actually hook this up and test loss of resistance. And once we get a loss of resistance, it will just be like this pretty much. That pretty much means you're in the epidural space. And there's always a possibility that you're not. Sometimes there's such thing as a false loss of resistance, but I won't go into all that. But yeah, basically we test for loss of resistance. Once we are going through the ligaments, we are testing for loss of resistance, and you keep going, inserting in, test, inserting in, test, inserting in, test. Then once you lost resistance, you should be in the epidural space, and that is when you disconnect this and can thread the catheter in. And if you can thread the catheter in pretty easily, you should be in the epidural space. But there's always a chance you're not, but usually you are. And then what else is in here? A little tiny syringe and a little tiny needle that we use to inject the local anesthetic to numb the patient's back. Some other things. This sticker is really important. It says, caution epidural catheter. So we put this on the end of the catheter. Once we put in the epidural, we put this sticker on the end of the catheter so people know not to inject medications through it, because we're letting them know this is an epidural catheter. This is not an IV. Do not put any medications in here. And then what else? Oh, and then just like a filter needle. And this is just to draw up our drugs. Since the vials that the different medications are in our glass, we just want to make sure no particles of glass get drawn up and into the syringe. So we have a filter needle, which helps prevent that. And what else? This little sponge, this just helps once we're finished and taping up the patient's back and making sure the epidural doesn't move. This is like a little sponge that can hold the end of the catheter, so it kind of just stays like on the patient's back. But that is the main parts of the epidural kit. So not comprehensive. I didn't go into excruciating detail, but I thought it would be interesting just to allow people to see what exactly is in the kit. But yeah, that's pretty much it. And I may eventually actually go through the process of like pretending to insert an epidural catheter on like a pillow or something, just so you guys can see it. But that's pretty much it.